Acne. Acne is a common skin condition that occurs when hair follicles become clogged with oil and dead skin cells. It often results in pimples, blackheads, whiteheads, and sometimes cysts or nodules. Acne can vary in severity and may cause emotional distress or scarring if left untreated. Eczema. Eczema is a chronic inflammatory skin condition characterized by itchy, red, and inflamed patches of skin. It often appears in childhood and may persist into adulthood. Eczema can be triggered by various factors, including genetics, environmental factors, and allergens. Psoriasis. Psoriasis is a chronic autoimmune disease that causes rapid skin cell growth, resulting in thick, red, and scaly patches of skin. These patches can be itchy, painful, and may crack and bleed. Psoriasis commonly affects the elbows, knees, scalp, and lower back, but it can occur anywhere on the body. Rosacea. Rosacea is a common chronic skin condition that primarily affects the face, causing redness, visible blood vessels, swelling, and acne-like breakouts. It often develops gradually and may worsen over time if left untreated. Triggers for rosacea include sun exposure, hot or spicy foods, alcohol, and stress. Dermatitis. Dermatitis refers to inflammation of the skin, which can have various causes, including allergic reactions, irritants, and genetic factors. Symptoms may include redness, itching, swelling, and blisters. There are different types of dermatitis, such as contact dermatitis, seborrheic dermatitis, and atopic dermatitis. Hives. Hives are raised, red, itchy welts on the skin that often result from an allergic reaction or other triggers, such as stress, medications, or infections. They can vary in size and shape and may come and go rapidly. In most cases, hives are not serious and resolve on their own, but severe cases may require medical treatment. Shingles. Shingles is a viral infection caused by the varicella zoster virus, which also causes chickenpox. After a person has had chickenpox, the virus can remain dormant in the body and reactivate later in life, causing shingles. It typically presents as a painful rash with blisters on one side of the body and may be accompanied by fever and fatigue. Vitiligo. Vitiligo is a chronic skin condition characterized by the loss of pigment in certain areas of the skin, resulting in white patches. The exact cause is unknown, but it is believed to involve autoimmune factors. Vitiligo can affect any part of the body and may progress over time, causing emotional distress for some individuals. Ringworm. Ringworm is a fungal infection of the skin that can affect various parts of the body, including the scalp, body, feet, athlete's foot, and groin. Despite its name, ringworm is not caused by a worm, but by fungi called dermatophytes. It typically presents as red, scaly, and itchy patches that may resemble a ring or circular shape. Impetigo. Impetigo is a highly contagious bacterial skin infection that commonly affects children. It is caused by bacteria such as Staphylococcus aureus or Streptococcus pyogenes and often occurs in areas with broken skin, such as around the nose and mouth. Impetigo presents as red sores that rupture and ooze fluid, forming yellowish crusts as they heal. Cellulitis. Cellulitis is a bacterial skin infection that affects the deeper layers of the skin and subcutaneous tissues. It typically occurs when bacteria enter the skin through a cut, wound, or insect bite. Cellulitis causes redness, swelling, warmth, and pain in the affected area, and it may spread rapidly if not treated promptly. Boils. Boils, also known as furuncles, are painful, pus-filled lumps that develop under the skin as a result of a bacterial infection, usually by Staphylococcus aureus. They often occur in areas with hair follicles, such as the face, neck, armpits, buttocks, and thighs. Boils can vary in size and may resolve on their own or require medical intervention, such as drainage or antibiotics, depending on their severity. Scabies. Scabies is a highly contagious skin infestation caused by the microscopic mite Sarcoptes scabii. It spreads through close personal contact and causes intense itching and a pimple-like rash. The mites burrow into the skin to lay eggs, leading to the characteristic symptoms. Warts. Warts are non-cancerous skin growths caused by the human papillomavirus, HPV. They can appear anywhere on the body and vary in size, shape, and appearance depending on the type of HPV involved. Warts are contagious and can spread through direct contact or contact with contaminated surfaces. Melasma. Melasma is a common skin condition characterized by patches of dark discoloration on the skin, typically on the face. It is more common in women and often occurs during pregnancy or with hormonal changes, such as those caused by birth control pills or hormone therapy. Sun exposure exacerbates melasma, so sunscreen and sun protection are important for managing the condition. Seborrheic Dermatitis. Seborrheic dermatitis is a common inflammatory skin condition that primarily affects areas rich in oil glands, such as the scalp, face, and chest. It causes redness, itching, and flaky patches of skin, commonly known as dandruff when it occurs on the scalp. While the exact cause is unknown, factors such as genetics, hormones, yeast overgrowth, and environmental triggers may contribute to its development. Lichen Planus. Lichen planus is a chronic inflammatory condition that affects the skin, mucous membranes, hair, and nails. It presents as shiny, flat-topped, purple-colored bumps on the skin, often with white lines or scales. Lichen planus can be itchy and uncomfortable, and it may affect various parts of the body, including the wrists, ankles, lower back, and genitals. The cause is not well understood, but it may involve immune system dysfunction. Actinic keratosis. Actinic keratosis, also known as solar keratosis, is a precancerous skin condition caused by long-term sun exposure. It appears as rough, scaly patches or lesions on sun-exposed areas, such as the face, scalp, hands, and arms. While actinic keratosis itself is not cancerous, it can progress to squamous cell carcinoma if left untreated. Bullous Pemphigoid. Bullous Pemphigoid is a rare autoimmune skin disorder characterized by large, fluid-filled blisters that develop on areas of the skin that flex or move, such as the abdomen, armpits, and groin. It occurs when the immune system mistakenly attacks the skin, causing separation of the layers of the skin and blister formation. Pityriasis Rosea. Pityriasis Rosea is a common self-limiting skin condition characterized by the sudden onset of a single, large, scaly patch known as a herald patch, followed by smaller, similar patches that spread over the trunk and sometimes the arms and legs. It may be accompanied by mild itching and typically resolves on its own within a few weeks to months without treatment. Folliculitis. Folliculitis is a common skin condition characterized by inflammation of the hair follicles, usually caused by bacterial or fungal infection, irritation, or ingrown hairs. It presents as red, pus-filled bumps or pustules that may be itchy or painful. Folliculitis can occur anywhere on the body where hair grows and is often treatable with topical or oral antibiotics, antifungal medications, or other treatments depending on the underlying cause. Scleroderma. Scleroderma is a chronic autoimmune disease that affects the skin and connective tissues, causing thickening, hardening, and tightening of the skin. It can also affect internal organs such as the lungs, heart, kidneys, and digestive tract, leading to serious complications. There are two main types of scleroderma: localized scleroderma, which primarily affects the skin, and systemic scleroderma, which can affect multiple organs. Lyme disease. Lyme disease is a bacterial infection transmitted to humans through the bite of infected black-legged ticks. It is caused by the bacterium Borrelia burgdorferi in North America and Borrelia afzeli or Borrelia guerini in Europe and Asia. Early symptoms include fever, headache, fatigue, and a characteristic bullseye rash called erythema migrans. Hidradenitis suppurativa. Hidradenitis suppurativa is a chronic inflammatory skin condition characterized by painful recurrent abscesses and nodules in areas rich in sweat glands, such as the armpits, groin, and buttocks. The exact cause is unknown, but it is thought to involve a combination of genetic, hormonal, and environmental factors. Perioral dermatitis. Perioral dermatitis is a facial rash that typically appears as red, bumpy, and slightly scaly patches around the mouth, nose, and eyes. The exact cause is unknown, but may be related to factors such as overuse of topical steroids, cosmetic products, or fluoride-containing toothpaste. Molluscum Contagiosum. Molluscum Contagiosum is a viral skin infection caused by the Molluscum Contagiosum virus, a member of the poxvirus family. It is characterized by small, raised, flesh-colored or pearly bumps on the skin with a central indentation or dimple. Molluscum Contagiosum is highly contagious and is spread through direct skin-to-skin contact or by sharing contaminated items. Erythema Multiforme. Erythema Multiforme is a skin condition characterized by the sudden onset of red, raised, target-like lesions on the skin, typically on the hands, feet, arms, and legs. It is often triggered by infections, medications, or other factors that cause an immune system reaction. Erythema multiforme can range from mild to severe and may be accompanied by fever, malaise, and mucous membrane involvement. Contact dermatitis. Contact dermatitis is a type of skin inflammation that occurs when the skin comes into contact with an irritant or allergen. Symptoms may include redness, itching, swelling, and blistering at the site of contact. Common irritants include soaps, detergents, cosmetics, and plants such as poison ivy. Allergic contact dermatitis occurs when the immune system reacts to a specific substance, such as nickel or latex. Stevens-Johnson syndrome. Stevens-Johnson syndrome is a rare but severe skin reaction that typically begins with flu-like symptoms, followed by the sudden onset of painful, blistering lesions on the skin and mucous membranes, including the mouth, eyes, and genitals. Toxic epidermal necrolysis. Toxic epidermal necrolysis is a life-threatening skin condition characterized by widespread blistering and detachment of the epidermis, outer layer of skin, from the underlying tissue. It is considered a severe form of Stevens-Johnson syndrome and shares similar triggers, such as medications, infections, or autoimmune diseases. Pemphigus. Pemphigus is a group of rare autoimmune disorders characterized by the formation of blisters and erosions on the skin and mucous membranes. It occurs when the immune system mistakenly attacks proteins that help hold skin cells together, leading to weakened cell adhesion and blister formation. Pemphigus can be life-threatening if not properly treated and requires immunosuppressive medications to control the autoimmune response. Ichthyosis. Ichthyosis refers to a group of genetic skin disorders characterized by dry, scaly, thickened skin that resembles fish scales. There are several types of ichthyosis, each with its own genetic cause and pattern of inheritance. Symptoms range from mild dryness and scaling to severe thickening and cracking of the skin, which can impact mobility and quality of life. Understanding these diverse skin conditions sheds light on the complexities of dermatology and highlights the importance of proper diagnosis and treatment. Remember, seeking medical advice from a dermatologist is crucial for managing these conditions effectively and maintaining skin health. Don't forget to like, subscribe, and share your thoughts in the comments below. Until next time.